Welcome to Tell Me About It, a podcast by SLPs for everybody. My name is Francie.
And my name is Maggie.
And today we have a very special guest to me because my best friend Kenzie is here.
Hello.
Kenzie, you are an occupational therapist.
Yes.
And I am so glad you're here because all of my besties work in allied healthcare. And you are here today to talk to us about your wheelhouse. But first, how did you get into OT?
So I am an OT because I grew up around OT. I grew up with a brother with a brain injury. So I was around OT frequently as a kid and I always loved it. And here we are. So I am going into my 4th year of OT now, and I've been in outpatient pediatrics since I graduated.
And we met in undergrad, and then we did our master's programs together at the same university.
Side by side.
We go way back. And so I feel very much, and I think you probably feel the same, where I feel like I learned so much about occupational therapy from you. And I'm sure you feel like you learned so much about speech therapy from me because we studied side by side so frequently.
Well, and I still text you for speech consultations.
All the time. We are constantly in each other's text messages being like, hey, I need a consultation. Like, what do you think about this therapy? Or like, have you heard of this before? And so we are constantly working together, and I love it. So we are here today specifically to talk about sensory. And I know that you do so much. Like I feel like it's not a majority of your caseload, but I feel like it's the majority of your caseload.
No, it's not the full majority, but it's often.
So for those who do not know, I see this, I feel like sensory is really getting the pop psychology treatment. Like I see it all the time on TikTok. What is it?
So sensory processing essentially encompasses a big overarching umbrella where, and some of my kids with sensory differences are impacted in some ways, some are impacted in other ways, some are impacted in all the ways, and some are impacted in one. So it kind of depends. It's a very broad spectrum, but essentially we have 8 sensory systems. Typically you only hear about the 5 that you talk about, your 5 senses that you learn about in school. So your touch, your taste, your smell, your hearing, and then your, sight,
vision,
vision, your sight. So we hear about your big 5, but there's actually 3 additional that are ones that we commonly work with in OT as well, where you have your vestibular processing. So those are your movement. That's the system that's responsible for motion sickness or your friends that are running all the time. We have our proprioceptive system, which is your system that's responsible for interpreting deep pressure. And then we also have your interoceptive system, which is the 8th sense that's not frequently talked about. So it's one that we are constantly educating about, and that's called interoception. And that is your sensory system that recognizes your internal body cues and then applies those to what they need to be applied to. So your body cues that tell you you're hungry and you need to eat, or that you need to go to the bathroom, or that you're starting to get angry, or any of those internal body signals is your interoception system.
Oh my gosh. I am already learning so much. I'm really, like Francie said a minute ago, I feel like sensory, like that word is so buzzy right now. And I think a lot of people just say sensory. And it to me as a speech therapist who certainly works with students that have sensory needs and sensory differences, it has almost lost all meaning to me. So I'm really excited to learn some more about it today.
Well, and again, because it's so broad, I think just sensory in and of itself is not a very descriptive word anymore because it's so overly used by everyone. So just telling me that a kid has sensory differences doesn't necessarily mean anything to me, because what is different about their sensory experience versus any other kid? So just the word sensory in and of itself is a big buzzword that doesn't necessarily mean anything specific to one child. You need more information than just sensory.
So when somebody says, because I have this happen to me in the schools where they'll be like, oh, they've got processing differences. And I'm like, what does that mean? When somebody comes to you and says, oh, they've got sensory needs, what information are you looking for?
Well, so first I need to know how specifically they're processing the sensory information to understand what that means. So we've got 4 big categories of sensory responders. And so those, you often hear the hypersensitive or hyposensitive. There's actually more than just that. And so I need to know.
Okay, I'm learning something now. This is new to me.
So we've got our 4 different categories, and our first category is our seekers. And those are your friends that are constantly running, constantly going, looking for more input all the time. They want the hands-on learning. They're running, they're crashing, they're jumping, they never seem to slow down. And those are your sensory seekers. And so we have our seekers, which I feel like is what a lot of people are often referring to when they talk about sensory needs or sensory differences, is our seekers that are constantly on the move. But then we also have 2 separate categories that sometimes get kind of lumped together. So I'll put them together, but they are distinct. You have your avoiders and then your sensors. So your avoiders are kids that avoid any and all sensory input in the areas that they have trouble with. So they do not like it. They don't want it. Your kids that are wearing headphones because they're sensitive to noise. Those are any of those types of kids. And so it can be, it can be noise as an example, but it can be anything where we're avoiding the sensory input. We don't like it. We don't want it. It's overstimulating. And then side by side with that, you also have your sensors, who are kids that are overly sensitive to sensory input. And so these kids often we see are sensitive in some areas, but not sensitive in others. So we might be sensitive to noise, but lights don't bother us. Or we might be sensitive to food textures, but noise doesn't bother us. And so you see kind of like up and down in different categories. And then our third category that is not talked about enough is our low registration kiddos. And so these are the kids that do not register sensory input. It takes a high threshold of input for them to process information. So they are missing cues that they are hungry. They're missing cues that they are thirsty. They miss cues that they are upset. These are my kids that have a broken arm and they walk around for 2 to 3 days with a broken arm because they're not processing pain. And so that's your other major category that often gets left out, is our kids that aren't processing sensory input much at all.
Would that encompass some kids that do like self-injury as well?
Sometimes. And so I think there needs to be more research in that area as well, because interoception is a relatively newer area that is still being, studied and researched. But I do personally in my practice find that sometimes my kids who are head hitters or like self-injurious will do that because it takes a lot of input for them to regulate themselves, and that deep pressure or that deep contact from the head hit or the arm squeezes or whatever it may be is more regulating to them than anything else, because they need that really intense input.
Yeah, I know self-injury is so complicated, and there's probably a dozen different reasons for each individual why that is happening. But I've wondered for some of my students, I've wondered if that's not a piece of the puzzle.
Yeah, I think the repetitive nature of it sometimes as well is soothing to some kids as well too. So when it's the same motion over and over and over, I say head hitting because I have a lot of head hitters right now. But in that context, I think sometimes that repetitive motion is regulating as well as the deep input. And then that's where we get into that cycle of we're stuck in the self-injurious.
Yeah. So when you have kids who come to you, because you're private practice, so oftentimes they are seeking you out, which is so fun and so different than the schools. But when they come to you, what do your sessions look like when you are addressing sensory needs as the primary concern? Because sensory can oftentimes be a secondary situation, because you oftentimes work with, actually speak to this for a second, because OTs are very special. Back up. We're going to back all the way up. Hey girl, what's an OT? Okay.
Back all the way up.
Yeah. For anyone who's watching that's unfamiliar with OT, OT stands for occupational therapy, and an occupation is just something that occupies your time. Let me go way back to my elevator speech from grad school. Just something that occupies your time. So anything that you do on a daily basis that is important to you is an occupation. And so that is something that I can work on in my scope of practice. And so typically with children, and the specific context is education related, because education is kiddos' jobs. That's their big occupation that they do. Education, play skills, any type of self-care skills. So that includes toileting, feeding themselves, dressing themselves, bathing, any of those nature activities, and then anything like motor coordination wise as well too, because that often also impacts our daily participation and things. So typically we see kids with deficits in the areas range. Like sometimes I see, like I just did an evaluation yesterday and my kiddo was only motor concerns. We had no other concerns. And then sometimes I come in with kids that have 12 concerns, and it's a big laundry list of things that we need to start working on. So anything that the root cause that causes an impact in their daily activities is something that we can work on, whether that be a sensory cause, a regulation cause, a motor cause, a vision cause, anything of that nature is something that we can typically work on.
So going back to original question before we had to side salad, when kids come to you for sensory as a primary or even sensory as a secondary, what do your sessions look like?
So, I mean, starting at the evaluation, honestly, I think is the biggest, like, so that we can get a handle on what's going on. We have a different assessment. We use an assessment called the sensory profile. Some clinicians use other sensory assessments. I'll be upfront and say that I am not certified in sensory integration. So I am not a therapist that has a lot of information on what sensory integration therapy looks like, but just overall sensory processing is something that we see frequently. So in the evaluation, we do an assessment called the sensory profile, and it goes through and it's a questionnaire for the parents that they have to go through and fill out a checklist and kind of identify how their kid is processing information. And then depending on the concerns that they're reporting, we will pick some sort of targeted activity to that area to observe how it's going for them. So this is one that's just so different to each kid. So it really does depend on like what systems are impacted and how they're processing that information. Because my session for a low registration kid is going to look way different than my session for a sensory seeker. And so understanding like where they're falling in that umbrella of terms, and then also understanding what specific areas, because within those, I might have a child who's seeking in vestibular or movement and proprioceptive and the deep pressure, but then they are avoiding of textures and sounds. And so I might have to mix and match different approaches, which is why sensory as a one size fits all word is not helpful, because it doesn't give you any real information or guidance on what to do with yourself and your practice. So once I kind of figure out what is going on with the kid, then we can kind of pick some more targeted activities. So if it's touch, then maybe we get some different textures out and see how they respond to that. If their sensory is directly impacting their feeding, then let's get the food out. Let's bring some food in and let's see what's going on there. If it's where we're seeking to the extent that we can't even sit down to learn, or we can't stay in a general area to learn, then what do we need to do to remove barriers in their environment? And then how can we get them more regulated? So honestly, our sessions are so vastly different. I could have 4 sensory kids in a row and I'm doing different things for every single one of them, because it really just depends on what I'm seeing and where they're falling.
Yeah. And that explanation is really helping me kind of put the pieces together too, because I've worked with OTs for years. I like co-treat with OTs. I love the occupational therapists that I've worked with in my like across the different settings. And right now, one of my school placements is at a school with medically complex kiddos. So what the OTs do is they have like more overlap with PT. Like it's a lot of motor-based stuff and also some sensory. But in the past, when I've worked with older kids, it's been like almost completely separate from physical therapy and way closer to what I'm doing. So it's really like, I mean, I think that our scope is broad as speech therapists, but like listening to you describe what OTs do, I'm like, dang, we've got some rivals for like the broad scope of practice girlies out here.
We're jumping around.
Yeah.
I'm doing a motor kid. I've got more high impacted kids. I've got kid I'm on the floor and I'm manipulating similar to how a PT would. And then my next kid comes in and it's an ADHDer that's a sensory seeker, and we got to pivot and do a whole different thing. So then I've got a little coming in and we're doing potty training. Like we are all over the place every day. It keeps me busy.
Yes. Oh my gosh.
Never bored.
Yeah.
So,
and
go ahead.
Your description of sensory, that like kind of overarching category term, I suppose, it like feels to me like if a parent were to call me up and be like, which this happens, they'll be like, hey, my child has an issue with language. I'm like, okay, give me more. Like, I'm like, that gives me almost nothing. Like, yes. I need to know what specifically, like, are they not talking? Are they talking, but it doesn't quite make sense? Do they have trouble learning words? Are they having issues with reading? Like, can they not answer questions? Can they not follow directions? Like, what do you mean by language? And so, yeah, okay, this has been really helpful already. It's only been like 15 minutes and I'm like, all right, this is great.
We're getting it.
You are getting there.
Yeah, we're getting there. So with that, I oftentimes hear like regulation is another word that comes in all the time when I hear people talking about sensory. So what is it? And why are we always in the pursuit of it? And can we ever really truly be regulated?
That's a great question, because honestly, I don't know that there's a solid answer to if everybody can ever truly be fully regulated at all points in time. But in terms of regulation, that is more of like, again, throwing it back to grad school, like your body's state of homeostasis, where everything is calm, everything is ideal. And so when we are regulated, we are seeing that our body and our brain are both matched that in a regulated state. And I would also like to throw in that regulation looks different depending on different kids or different people. So my regulated state looks much different than maybe your regulated state. And so that's where it comes in, like knowing the client that you're working with and knowing what their typical looks like. And if their typical is not functional, they're not able to participate in activities, then their baseline is dysregulation. So we are searching for a typical baseline where they are able to participate in activities. And so again, that may change based on different kids. So regulation for one of my kids, maybe we are rocking back and forth in a chair, but we're able to concentrate and focus and do our activities, and we're not still. And from the surface, his body doesn't look calm, but his brain is calm. And his body is doing what it needs to regulate his nervous system so that he feels like he is able to participate. So regulation is different. And again, that's where, like I said, knowing your client and knowing what their baseline is helpful. But typically I use ability to participate in an activity as a baseline for regulation. To be said, sometimes we have kids that are participating in an activity and they are dysregulated. I have had my fair share of times where I have a pegboard out in front of my child and I'm like, here, let's put him in. And they're like, but they're doing it anyway. So I mean, that's, again, take that with a grain of salt, but typically being able to participate in an activity, like to the extent of what the activity is supposed to be, is what I classify as what regulated looks like for my kids.
And I think that's a really important point, or the point that it can look different for every child, because you could have two students where one, like you described, is rocking back and forth during an activity, but is locked in, fully focused, participating, and calm on the inside. And that is kind of evidenced by this rocking back and forth. But then you can have another student who is rocking back and forth because they're stressed out and they are trying to self-soothe. They're trying to get to a state of regulation. And I've worked with adults in school settings where those two things kind of get confused. And so I think that sometimes we, as the adults in the school setting, need to kind of zoom out and think about, like, okay, just because a kid is stimming doesn't mean that they're regulated. That stimming is not always like the regulating thing for them.
Yes. And that's, I mean, on that same pivot point, I tell people all the time too, that sitting still does not always equate to regulation. So some kids are sitting still and that means that they're regulated, but that's not true for every child. So when I have parents come through, they're like, they're not sitting still. They won't sit down and do an activity. Well, I raise the point, do they need to sit down to do the activity? Is sitting down regulating for them? I have some kids that they sit down and their brain cannot focus because they need the movement, and the movement is what's regulating to them. So if they're sitting down and they're being forced to sit still, they're not regulated enough to participate in the activity because their body is screaming at them that they need to move. And when they're having these overwhelming sensations in their body that's telling them, like, I need to do this, it is very hard to pay attention to something. Like, think about if your bladder is bursting and you are in the middle of doing something. You're like, oh my gosh, I have to pee so bad. And that is all that you can focus on, is that sensation. And so I see that sometimes in my children as well too, who are being forced to sit still, or they're being forced to sit in a loud classroom without a sensory accommodation. This sensation is screaming to their body that, hey, something is wrong. But on the surface, they appear regulated, and because they're still. And so that sometimes is something that's important as well too, for my families to understand, that sitting still and being quiet does not necessarily mean that the child is regulated.
I fear this is going to get us off on a tangent, but I really want to ask you about this.
Bring on the tangents.
So I have been personally kind of waging war on fidgets because I think what happened in a lot of school settings is adults came in with all of these really fun, colorful toys and put them in a basket open in the classroom and said, this helps you focus. Go for it. And the kids were like, oh my God, playtime. Like, I feel like that. So a lot of fidgets have just been like kind of given to kids literally as toys.
Yes.
And then they kind of get the idea of like, oh, this is quote unquote helping me focus, when actually it is pulling their focus from the task and now they're playing.
Yes.
But then when we try to remove the fidget, it's like, no, you're taking away the tool to help me focus. And for some kids, I am a big fidgeter, like personally, and I always
with my Nido.
Yes, I have like my drawer underneath my computer. I was just thinking about getting out a little clicky toy, but it's bad for an audio format. But like even as a kid, I would like doodle, and like I was a big, I don't know, I would like braid and make friendship bracelets while I listened to things, and so I understand that for some kids that really, really helps. But for some kids, it does the opposite, and it pulls focus and it puts them in a place where they're unable to do what they need to do. So I wondered if you agree with that, if you disagree, if you have thoughts, feelings, opinions about fidgets.
Yeah, I agree wholeheartedly with the becoming a toy. And I hate when they're presented in the method of this is a toy, because I always tell my kids these are tools and they are not toys. They are tools to support your attention. If you are using it as a toy, we will not have access to it, because sometimes I see my kids that they get the squishy balls out and they're throwing them across the room, and that is not what it's for. It's not. Yeah. It's not.
That's not exactly focused and regulating.
Yes, exactly. Well, and then
a needle across the room.
We're now disrupting everybody else in the environment as well when we're being disrupted with the fidget. So I tell my kids frequently, all the time, like, this is a tool and not a toy. And if it's not being used appropriately, then I will put it away. And I'm happy to let you have it to fidget. And if we can't use the fidget appropriately, then I will find a tool that we can use appropriately. And that might be wrap an exercise band around the legs of the chairs, and so they have something to kick against. Or sometimes I have a Lycra band that I'll tie to the leg of my chair, and the kids can like kind of yank on it. So if I don't remove the support entirely, but if we're not being safe and we're not using the fidget appropriately, then I will remove it, because it's becoming more of a distraction, and then it's not being used how it's supposed to be used. And then my other thing with that as well is kind of like you said, that everybody's using them like a toy, and then the teachers are getting fed up with them because everybody's using them like toys. So then my children that do need them and are capable of using them appropriately no longer have access to them because they've been taken away because other kids were not using them appropriately. So I usually tell my kids if they want to use a fidget in school, granted, again, I'm an outpatient therapist, so they have to run this by their school, their 504 team, their IEP team, whatever that may be. But we need to pick something that is quiet. We need to pick something that will not explode. Because I could not even tell you.
I have like stress ball contents I have swept up off of my office floor is yeah.
The Orbeez balls, I love those. The kids love them. Explode everywhere. Just Orbeez explosion. And while they're fun, not great for the classroom, because it's one Orbeez ball explosion away from not being able to have fidgets anymore. So I say they need to be quiet, they need to not explode, and they need to be not distracting. And so I like the Nidos because I feel like they're more durable, and a lot of my older kids handle them very well. For my littles, things like suction cups or like the clicky things are hard because they're so disruptive in class because they're loud. I like the monkey noodles also for the older kids, but then I find the younger ones are swinging them around and they're throwing them. So I have to work with all the kids, and we have to find one that is suitable for each child, that is, helpful and doesn't become a distraction, because they do become a distraction. And then it's a bigger problem because now we're distracted because we're using this thing that's supposed to help us focus, but it's doing the exact opposite.
Yeah. I have exclusively made those like plastic pop tubes a toy in my therapy room, just because I think for children, there's not a way to use it quietly.
Yeah,
like I, as an adult, can sit there and like pop it 1 or 2 times and then put it back and have it be like relatively quiet, kind of like clicking a pen. Yeah. But then that still can aggravate other people. If you're like in a meeting clicking a pen, some people really hate that. And so it's still loud kind of no matter what you do with it. So those have been like completely removed from my like fidgets option, and I have only silent fidgets now.
Yeah, the pop tubes are not fidgets in our clinic. Pop tubes are bilateral coordination toys, and we pull them apart and we push them together. Pop tubes are not fidgets. They are too loud to be fidgets. Same with those keyboard clickers. I love the keyboard clickers, but they are too loud to be fidgets in the classroom. They can be fidgets at home when you're working on homework. They can be fidgets in OT because they're not going to bother me, but they cannot be a fidget in a classroom because it is too loud and it's going to disrupt everybody else around you.
It's real. Okay, cool. Thank you for that side note.
So now we're still going to go on this tangent, because at every school district that I've been in, it has been mandatory that classrooms have like a calm down corner, and then in those corners they have a bucket of fidgets, and some like breathing exercise. So Kenzie, if you could improve upon that, what would you recommend to like make that better than just like, here's a bucket of toys ?
Yeah. So I do like the idea of having the calming corners. I think it's really beneficial, especially for my younger learners, because they, especially ones that teachers are wanting them to independently initiate the calm down process, having a space for like a dedicated space for them to go and do that is helpful. But whenever I talk to, especially parents, about making them at home, I always encourage people to make a rule of like, if we are in the calm down corner, we are not approached until we are ready to be approached. Because if we are going to that space to calm down, then that's what it needs to be for. And so in the classroom, I would encourage teachers to make rules as well for like, this is not a toy. And if the fidgets need to be picked up and put in a cabinet until a student is actually actively over there using it, and then we bring them over type of situation. And it's just a no comment, no words, I'm going to set these down and I'm going to walk away type of thing, so that it seems less enticing for kids to want to go over there and play, because that's not what it's for. If it's a calming corner, it's for calming yourself. It's not for playtime. And when we present it as playtime, it makes kids less likely to go over there when they are dysregulated. So the calm space needs to be the designated calm space. And again, I am pro picking up the fidgets, putting them in a cabinet. And then if a kid goes over there, like, oh, let me just drop these off here, and they're at your disposal. Because then I feel like that also reduces the instances of kids going over there because they want to play with the fidgets. Because that is something that I hear frequently of, especially my little friends with low impulse control, is they're like, oh, there's a bucket of toys over there. I'm going to go over there because I want to play with the bucket of toys. I don't want to learn. I don't want to do math. That sucks. I want to play with the toys. And so removing those, letting students know they are accessible. If you're over here and you need them, I will bring them to you, but they're not just out accessible all the time, might reduce some of those instances as well. Also a firm believer that every calm down corner needs to have a pillow. If they don't have a pillow, you need to put a pillow in there. Pillows are very important part of a calm down corner, because the amount of times that I tell my kids, I would rather you hit a pillow than hit a person, is high. That's probably something I say multiple times a week. I would rather you hit a pillow than I would rather you hit a person. So I'm big fan, especially for my hitters, that we need to have something else to hit. If our body needs to hit, then we need to have something else to hit. Yeah. And if there's a pillow in the calming corner, we are so much more likely to hit the pillow than we are to hit the peers.
Yes, that. Oh, sorry. I lost my train of thought the second I opened my mouth. I apologize. Never mind. I'll bring it up again if I think of it. I'm sorry.
So, Kenzie, in our personal life, I know that you have some beef with some school districts.
I do.
So, oftentimes I see some of these calming corners kind of break that trust in like the sensory regulation, and I'm using that term generally, like supporting sensory needs, because they're like, oh my gosh, it's become toys or whatever. So what are some, if you could speak directly to school districts to tell them, these are the things that would help you out, or like, these are accommodations, these are modifications that I recommend, what would you say to them?
The biggest thing I would say is follow the IEP, because that's where I get in the beef, is because nobody follows the IEP. And I hear from teachers and I hear from parents, they're like, they're doing so bad at school. And I'm like, are we following the plans that are in place by their IEP that me and their school OT worked on putting together? And then almost always the answer is no. And when we are not following the accommodations that are put in place, no wonder we're struggling, because we're not using the accommodations that were put in place. And that is all like my biggest pet peeve that I have with school districts, is that we're ignoring and not following the IEP, especially when it's been tailored to the kid's specific needs, because similar to what I was saying earlier, like, every kid processes sensory information in such a different way. And so some kids, the calming corner might be super regulating. And for other kids, that is not what they need. They need something different. And so if I have a child that needs something different than a calming corner, and it is in their IEP that they are to receive something different than the calming corner, when you're redirecting them to the calming corner, we are not resolving the issue, because the IEP states that we need this. And if this is what we need, then this is what we need. We should not be redirecting to the calming corner if it's not helpful. But for, teachers and things that have calming corners in classrooms, I would again encourage like a discussion about what it is, why it's there, and why it's important at the beginning of the school year, so that it's not being perceived as a fun playing place or a tool, or it's seen as a tool and not as a fun playing place. It's not a cozy corner, it's a calming corner, because cozy corner and calming corner are very different in my perception. A cozy corner is somewhere you can go and read and it's comfy and you can lay there and you can, hang out and you can chat with your friends during like downtime or whatever. A calming corner is a corner that is specifically designated for calming yourself down. And whatever that might look like, that is what this corner is for. This corner is not for chatting. This corner is not for playing with toys, unless that is what will help you regulate yourself in that moment. So having a discussion at the beginning of the year that, this is what this corner is, this is what it's for. If you need to go over here, your body might look like this, 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 or this. And that's what tells me you need to go to the calming corner. So if your body is having a hard time sitting still and it is feeling like it needs to run all over the place, maybe we need to go to the calming corner. If your body is feeling like it needs to cry, if your body is feeling like it needs to hit something, if your body is feeling like it's really, really hot, or it feels really overwhelmed and you can't calm down, that's when we need to go to the calming corner, and making those very clear distinctions so that it seems, again, it's presented in a way that it's a tool and not a toy.
Mm-hmm. I found my train of thought, and it was this discussion that like brought it back to mind. I think that there is a fine line that we kind of have to walk as therapists, but also just as adults that are teaching regulation strategies to kids. Because kids aren't born knowing how to regulate, and they're not born knowing the difference between I'm in like a dysregulated state or even like crisis, or I don't want to do this because it's not fun and I don't like it. There is a difference between those two things. And kids are little stinkers. Sometimes they don't want to do things because it's not their favorite. And I feel that way too. I have tasks that are not preferred as an adult, but I'm an adult and I know the difference between like that you're like, I really have to pee analogy of like, oh my gosh, I'm so stressed out. I can't handle this. I can't do it until a need is met. And or that like the flip side of that of like, I hate doing this, so I'm going to put it off and put it off and put it off until, oh God, now I have to do it. So I guess like what would be your advice for people in a school setting or any other kind of therapeutic setting working with kids on like identifying the difference between those two for children?
Yes. And so that's kind of where this interoception, like that eighth sense, comes into play. And that's something that we're frequently teaching in OT, especially in terms of like emotional regulation, sensory regulation. Big regulation tool is that interoception. And this is something that me and several of my coworkers have done like bunches and bunches of CEUs. So we just, have extensive information on this. But kids, especially neurodivergent kids, have a harder time learning what body signals connect to what emotions or connect to what like overarching activity needs to occur. So again, with the bladder, we recognize that. A kid who's just potty training does not recognize that. They're still learning. So they may need that increased fullness to feel that. So in terms of a sensory or a emotional regulation perspective, sometimes our kids need extremely intense body cues to recognize that emotion or that, again, whatever sensation they're feeling. And so that's why sometimes we see our kids that go from 0 to 100 very quickly, because they're not registering that buildup. They're not registering the, 20 to 60 part. And then all of a sudden it's, oh my God, I'm going to die. I'm so overwhelmed. I'm terrified. And so that's where we use a lot of that. We have a curriculum that we use. It's the Kelly Mahler interoception curriculum. And we go through that. It's a lovely curriculum that's made for OTs. And so we go through that, and it practices teaching children to recognize their external body signals first, and then it moves more internal. So how do your hands feel? How do your feet feel? And then it goes through various external body parts and then moves internal, and your heart and your lungs and your brain and your bladder and your stomach and all of those different pieces, and then practices putting them together so that we can combine those body signals with the emotions. But the easiest tip that I have for parents or teachers or, speech therapists, in this case, any other providers, is make observations out loud. Like, your body looks like it's hot right now, or your hands look like they're having a hard time sitting still. I'm noticing that your feet look like they're wanting to kick right now, or I'm noticing that your voice is getting loud. That indicates to me that this, and then kind of help them fill in the blanks. So a lot of times I'll have my kids and I'll be like, how are we feeling right now? And they're like, and they're screaming, and obviously they're not happy. So what I would do in that situation of like, your voice is very loud and your tone is very harsh. And I see that your hands are in a fist and they look tight. And that to me shows that you are feeling frustrated. I think we're maybe feeling frustrated. What do we need to do? And try to help them put together those signals with what may be happening so that they can jump to that conclusion. And so then even my kids who can't actively participate in something that they need to calm down, I'll even tell them, like, when I'm frustrated, I do this. And then I will just model it for them without the expectation of them participating in it. So, and I would say probably 80% of the time the kids imitate me and they do what I do. So when I'm frustrated, I take a deep breath, and then I take a big exaggerated deep breath, and so that the kids can see that. And it might take 4 or 5, but typically after I do a few, the kids start to kind of imitate me and they do it too. And a lot of times that comes back down. But even like feeling seen and feeling heard and making those connections sometimes will already start de-escalating a situation. Now I'm going to jump off on a tangent again here. But as to your question of like the difference between like just not wanting to do a task versus actually being dysregulated. Oftentimes as adults, I feel like it's easier for us to see that in a kid, that like, I can tell this is just a hard task and you're anxious, versus I can tell that you're dysregulated. And this is where I have a conversation with my older kids or my families or teachers or whoever's asking about reasonable accommodations. And so that is what I tell my children often is like, I can make a reasonable accommodation for you because you're feeling overwhelmed, but it is an unreasonable accommodation for you to expect me to let you not do this task. So math is important. We have to do the math. We can't not do the math, but I can give you, and then I may give them like 2 or 3 choices of a reasonable accommodation to help the task feel less overwhelming or less frustrating. Because I mean, emotions feel big, and I accommodate myself. If I don't want to do my dishes, then maybe I'm going to give myself an extra 10 minutes before I do my dishes. And it's within the wheelhouse to provide children with a reasonable accommodation. But I think sometimes kids think that if we escalate, then we're going to get out of the task. So then that's the other where I draw the line as well of like, I'm happy to give you
I'm writing this down now.
You're taking notes.
I'm writing this down now.
I use those words, like that exact verbiage of like, I can give you a reasonable accommodation, but we have to do this. And typically in OT, that's a handwriting, because a lot of my older children do not like to work on handwriting. So like, I hear you. I hear what you're feeling. I'm sorry that this is frustrating for you, and I get that this is hard, but we do have to do it. So I can give you a reasonable accommodation. Here's your choices, but we can't not do the task. And typically that goes very well. And then educating parents on that as well too, because those are a lot of the times my parents that feel like the kids are running the household, where they're like, well, they just throw a huge fit if this happens, and I just don't have time to deal with it, and all of this stuff. And so again, that's where we talk about the like, I'm drawing a boundary, I'm giving you a reasonable accommodation, but we do have to do this. And that is totally different than a true sensory dysregulation, because if I have a child who's truly in a fight or flight state of sensory dysregulation, I will not be forcing them to do it. Like we're not doing it. We're being regulated first. We're going to calm our nervous system, and then we're going to worry about that later. This conversation is truly for those kids that they're not in a sensory state of dysregulation. They're just, the task is hard or it's new and they're anxious about it and they don't want to do it. And that's very distinct differences.
That's really helpful. And I kind of just made a connection between something that I have heard as a physical therapy patient. I've done PT for some chronic pain in the past, and my PT told me like there is a difference between discomfort and pain, and like I need to push you to discomfort. So like, but it was up to me, because that's an internal experience, to decide where that threshold is, which can be really tricky because discomfort doesn't feel good either. And so it makes me think about those kids that you were talking about earlier, that kind of like hypothetical child who needs a really big emotional experience to even clock that emotion. That might come across as like quote unquote pain, but I wonder like if there's kind of, and maybe part of the therapeutic process is moving that threshold lower and lower so that it remains in that discomfort arena and not pain.
Yes, and that's part of our process sometimes when we go through that interoception, is teaching kids to recognize that threshold lower, so that the threshold that they need of that sensory input is not so high. Because if we're needing 10 out of 10 sensations to notice something, then we are escalating very quickly, and it takes us a really long time to come back down. Like, I mean, even as an adult, like think about, you know, if you're having a really hard day and you're having a meltdown and we're like peak, like, you know, crying, it's the whole shebang, and it's really hard to settle back down after that. And our kids are little, they have little bodies and they have big emotions. And so when they're feeling these huge emotions in their tiny bodies, it's really hard to come back down. And so part of our process in that is teaching them to recognize the threshold lower and lower. And it may not be as low as, you know, like a neurotypical child may be, and that's okay. It's whatever it looks like for that kid, but trying to lower that threshold so that we're noticing things sooner and sooner and sooner, so that we're not getting to the point that we're exploding whenever we're feeling an emotion. And then again, I also consider that in my, and I think that's sometimes where we get in the like, everything is sensory, because everything is not sensory. I might get some backlash for that.
Canceled.
I truly don't believe that everything is sensory. A lot of things are sensory. A lot of our neurodivergent kids have sensory differences. Sensory stuff is very common. You know, again, like I'm not negating the fact that that is common, but I think sometimes that interoceptive threshold that causes the emotional dysregulation is sensory. And so that I think is some of why everything is being called sensory. But not all kids have that interoceptive difficulty as well either. So that's, some kids have it, some kids don't. And that's something that is, you know, we see through the evaluative process and all of that stuff as well too. But that is something that we work on, is trying to lower that threshold so that they can, you know, recognize it sooner.
That reminds me of if you're going to catch heat on the internet, I'll catch it with you. That reminds me of like the kind of phrase in our field of like, all behavior is communication. No, it isn't. Like, no, it's not. Some behavior is just behavior. Sometimes they're just doing that. Sometimes they just like it. Or like, is falling asleep a behavior? What is that communicating? I'm sleepy. Okay. Like that's not revolutionary, you know, like it's not. So like, yeah, I've had kind of some beef with that phrase that's really taken over the SLP realm on the internet too, of like, not everything is sensory, not all behavior is communication. A lot of it is, but not 100%. And we have to have that nuance in order to be good therapists.
Yeah. Well, and I mean, emotions in and of themselves are a sensory experience. Like we all have, you know, like it just depends on the way that we process the sensory input to depend on the way that we process the emotions. But when we're all anxious, we feel that differently. Everybody feels, you know, emotions differently, which is something we love about this interoception curriculum, because it's very neuroaffirming and teaches kids to understand their own body signals and not a universally recognized body signal. So it doesn't work on the like, let's look at the face. This person is smiling, so they are happy. Like happy to another kid might not feel like that, and to, you know, somebody with a brain that processes information differently than even mine does might feel happy in a different way, and so they might feel anxious or angry or sick or whatever feeling it is in a different way than the way that I feel it. And that doesn't make it wrong. It just makes it a different sensory experience than the experience that I'm having. And so if to me my anger does not feel hot, but I have another kid that recognizes that, oh, when I start to get angry, I feel hot, and they're recognizing that that signal goes with that, then they're learning to connect those pieces. And so their puzzle pieces might look different than my puzzle pieces, and that's okay. But what we can do is work on teaching them to put those puzzle pieces together so that they can put their puzzle together, and then I can put my puzzle together, so that it's all kind of, it's our own connection. And so where was I going with that? But emotions in and of themselves are a sensory experience, and that doesn't necessarily make it a sensory difference, because everyone has emotions and everyone experiences emotions in their own way. And that doesn't necessarily make it like a sensory processing difference.
Very cool. That curriculum sounds awesome.
It
sounds really cool.
It is a great curriculum. If there's any OTs watching this podcast, you should look at the Kelly Fowler Interoception curriculum. It's a great curriculum. It has a lot of really great information. She has some really great continuing education units and a lot of really good information on that. But one of my faves.
So with that, one thing that I've been thinking about, both with the pain and discomfort conversation and kind of meeting those thresholds, I feel like seeing on the internet people say like, oh, I'm overstimulated. I've been seeing a lot. So what would be the difference between overwhelm and overstimulated?
Yeah. So I typically phrase overwhelm as more of like an anxiety standpoint. And I mean, sometimes you can have sensory overwhelm, but if we're going like overwhelmed versus overstimulated, I would call overstimulated the more sensory of the two. Whereas overwhelm is more of like, this is hard, this is overwhelming, this seems difficult. And those are a lot of the times my kids that have lower confidence. And so participating in like a difficult task seems like it's too much for them. And so that's where I get in my positive self-talk and like, we can do hard things, friend, we can do it. And, getting some of those phrases in there and trying to work on being more confident and trying things that are difficult, or working through, whatever anxiety or overwhelm we might be having with the task. And sometimes it's just that the task seems too big and there's too many steps. And so we need to break it down into smaller steps, and then the task seems easier and then we can get it done. Versus that overstimulation, which is that like, there's either too much sensory input or the sensory input is too different, or there's too many different types, or something is going on from a sensory standpoint that we are too like overstimulated to be able to do something. And again, that looks different with our different kids that process sensory information differently. So my sensory avoiders or my sensitive kids, that's going to look a lot different than my seekers. My sensory seekers that are overstimulated are my ones that are like bouncing off the walls, and they come in and you're like, whoa, what happened to you today? Why are we doing this? And they're just running back and forth and constant, because that's dysregulation too. And so they're not in a regulated state, and they are even more elevated than their baseline, and they are so overstimulated, and we are just woo everywhere. And then other times I have my kids who are sensitive to things, and that might look like there's somebody's tapping their pencil in the classroom and the teacher is talking at the same time, and processing both of those auditory experiences at the same time is too much, and we're overstimulated by that. Or maybe the classroom is too cold and we're very sensitive to temperature, and the classroom is too cold and the teacher's giving you information that is it's hard. And so then your brain feels like, oh my gosh, I'm trying to process this hard thing, and then I'm not focused because it's so cold. And then that's, in and of itself, sometimes an overstimulation as well too, because there's multiple things going on at the same time. And I know a lot of people use those words interchangeably, but for me personally, I consider overwhelm more of like an anxiety, this is hard, versus an overstimulated of like there's something sensory wise that is stimulating our brain in a way that is not good for our participation.
Yeah. I was gonna like break it down and then like check with you to confirm if that's like the right kind of breakdown for it, of like overwhelmed is like, woo, this is a lot, but like deep breath, I can do this. Mm-hmm. Versus overstimulated is like, I need a break or I'm gonna cry. Like that's that's the difference there.
That's similar to what I was describing with the emotional and the reasonable accommodations. Like overwhelm, we can do something like we can work through it. Like let's use a strategy and let's keep going, or let's, figure out what we need to do to help get ourselves back to baseline, and then let's keep going. Whereas overstimulation is oftentimes like, we need to stop what we're doing and we need to deal with this before we even think about resuming the task. Because trying to ask an overstimulated person to do anything, especially when because sometimes that overstimulation pushes our nervous system into fight or flight. And so then are we doing the task? to the best of our ability? Are we actually doing the task? Are we actually learning anything from the task? Because often what we hear from a sensory standpoint is when we are in fight or flight, learning can no longer occur. So anything that you are trying to get that child to do while they are in fight or flight, they are not taking in that information. They are not learning, and it is not doing them any good. So those are my kids that are putting the pegs in the pegboard, and they're
Yes.
so like they're not learning anything from that. And from that, it's more beneficial for me to stop and be like, okay, something is going on here. We need to figure out what's going on. We need to resolve this situation before we even think about returning to this.
Yeah. And it is crazy like mind-blowing how widely those like thresholds can vary for each kid. Because I have some kids that can work for a whole hour with maybe like one little break doing like tabletop tasks if we're doing like literacy or something. They can really sit there for a whole hour and do handwriting. They can do reading. They can do all of this stuff with like one little break in the middle. And then I have other kids where I get through 3 trials of a structured task and I'm like, okay, I'm seeing that you're stressed. I'm seeing that you're starting to like show me those outward signs of being overwhelmed. So we're going to take a break. And like, and a huge win for the session would be getting 5 trials for like in like 30, 45 minutes. And so it's really fascinating how that can be different for each kid.
Yeah. And that's where I don't like the one size fits all approach for sensory. There used to be this huge push for what was called sensory diets. And while I'm not knocking sensory diets or any way, shape, or form. But what they used to sometimes be was that it would just be this list of sensory activities and you would give it to every kid and you would give every kid the same activities. And then there would be so many like, it would work sometimes for some kids because sometimes that's what they needed. And then there would be all these other families that are like, this doesn't do anything. Like this is making it worse, or this isn't helping, or, you know, because every kid processes information and needs different things. And so giving every kid the same expectation and the same activities just doesn't work. And so from a sensory accommodation standpoint, one of my favorite things recently has been, especially with my older clients, and this is, you know, it's harder with non-speaking clients because then I have to try to do more of the like inferring for myself. But with my older kids, especially my ones that are very verbal and very cognizant, I do a lot of like, I got my master list of accommodations. Let's sit down and I'm going to read through all of them. And you're going to tell me yes or no if you think that that would help you. And I do that so often. I did that 3 times this week because I've got kids gearing up for middle school. And I'm like, let's sit down, let's read through this and let's figure out what will be helpful for you so that we know what we need to do. And so I'll read through them and we'll explain anything that needs to be explained. And they can tell me, yes, that would be helpful, or no, that wouldn't be helpful. So then I know what to recommend, or if I'm talking to school or if parents are talking to school, then that way everybody goes into that meeting feeling prepared that like, this is what kind of accommodations would be helpful. So that's recently been one of my favorite things to do. Especially the kids love it because they feel so included and they're like, oh my gosh, I get a say. And like, what's going to, I'm like, girl, it's about you. Like, yeah, you get a say. Like, I want you to tell me what is helpful for you. And for my younger kids, again, sometimes that looks like more like trial and error and like making inferences of like, you know, we tried this and it went real bad. So we're going to try something different. And that did not work. So it's very trial and error on accommodations, but
very cool.
Yeah.
I like that a lot.
I have learned so much today, and I have things I will be taking to work on Monday. So.
Yay! I also have like 15 other questions for you, but I know that we're out of time. So yeah, we'll have to do this again sometime if you're down for it.
Yeah, if you want me back for part 2, let me know.
Yeah, this has been so informative, and yes, absolutely, like bringing with me to work on Monday, and when this episode comes out, being like, hey, low-key coworkers, you should listen to this. Kenzie is really awesome.
Thank you.
All right.
Thanks
well,
for having me, guys. This was fun.
Thank you.
Thank you for coming on. If you are listening to this on YouTube or Spotify, you can find us where you found us at Tell Me About It, an SLP podcast. And if you would love to join us on Instagram, we are there at Tell Me About It SLP. And we will see you next time for more conversations about therapy and speech and language and disability and all the things. Bye.
Bye.